When people think of Cambodia, some might think of the magnificent temple ruins of Angkor Wat, the quaint floating villages of Tonle Sap Lake, or the beautiful Buddhist pagodas and the many monks that walk through the streets and villages in their bright, colorful robes. Others might remember the civil war that turned the peaceful rice paddies of Cambodia into horrific killing fields. From 1975 to 1979, Pol Pot and the Khmer Rouge initiated a brutal campaign against merchants, teachers, nurses, doctors, engineers, and civil servants. During this 4-year campaign against civilization and the educated, an estimated 2 million people lost their lives. For years, people remained trapped in patterns of social dysfunction and self-destruction. Families were large, but children grew up in an environment of ignorance, violence, and abuse. They were without hospitals, schools, or sanitation, and lacked many basic life skills. Even as the Khmer Rouge continued to try and keep control of the country, the Adventist Development and Relief Agency, ADRA, was working in the country with official recognition of the Royal Government of Cambodia in 1991. Since that time, ADRA Cambodia has been making a real difference in the lives of people, helping them with food security, water and sanitation, health and education. A primary focus during these early years was to bring food to a shell-shocked people. In Siem Reap, the ancient Ba Rai irrigation system was rehabilitated. The people were provided with high-quality seeds and introduced to methods of farming that provided greater yields and thus more food and better incomes. Through ADRA, the people learned how to grow good vegetable gardens, make money from fruit trees and fish farms, and how to keep livestock. Over the years that followed, ADRA Cambodia took these initial programs to many other regions of the country and added new features to build on the success. ADRA began to include programs of adult literacy, skills training, small business management, small loans, and community cooperative groups, all the while keeping a primary focus on sustainable systems of food security and environmental management. ADRA's program to improve access to water and sanitation for families has been critical to achieving food security and ensuring family health. ADRA has built the capacity of community partners to construct and install over 7,000 open ring and bored wells, 5,000 water collection tanks and pumps, and several community dams. Over 5,000 quality latrines have been built, and people have learned the importance of hygiene and using clean water for bathing and drinking. To help rebuild the health system that was destroyed during the war, ADRA Cambodia began conducting a Masters in Public Health training program in cooperation with the Ministry of Health in 1993. Through the years, ADRA has helped to rebuild health clinics and train rural health providers. Individuals from rural villages are selected to become health promoters and are brought together for primary health training. Supplied with basic teaching tools, they then go back to their communities and disseminate the information that they have learned. Special attention is given to mother and child health issues, including the teaching of traditional birth attendants on safe methods and practices of delivering babies, and the importance of referring their clients to professional services. As the prevalence rate of HIV/AIDS rose to its peak in the late 1990s, ADRA integrated HIV/AIDS education and behavioral change into its development programs. Peer-to-peer education programs recruited youth leaders from rural villages, taught them principles of sexual reproductive health, and sent them back to their communities to share their knowledge with their friends, as well as their parents. Presentations at large events, as well as over local and national media, has helped to spread the word about HIV and other sexually transmitted diseases. As ADRA Cambodia worked with the Ministry of Health and continued to develop their programs of health education, they began to incorporate warnings about the health risks of using tobacco products. Dismayed by the high usage rates, an estimated 70% or more among men, ADRA Cambodia launched its tobacco, or Health Awareness Education Program, in 1997. Over the years, this initiative has grown and gained the support of educators, religious leaders, and government officials. Anti-tobacco awareness programs, conducted at the training pagodas in Phnom Penh, have gained the acceptance of many young monks who not only quit smoking themselves, but also went back to their villages and used their influence to encourage other young people to also be smoke-free. Working with the schools, ADRA has introduced a curriculum, produced materials, and taught teachers how to present an anti-tobacco message to their students. Today, many schools, pagodas, and workplaces throughout Cambodia have officially been declared smoke-free zones. As ADRA partnered with the World Health Organization, the Ministry of Health, the Ministry of Cults and Religion, as well as many other government and non-governmental organizations in Cambodia, they began to influence lawmakers to impose major restrictions on the tobacco industry in terms of advertising and health warnings. As of August 2011, all forms of tobacco advertising in Cambodia have been banned. The overall result has been an amazing reduction in usage rates. The latest national survey in 2010 shows that tobacco usage among men in Cambodia has dropped from a high of 70% or more down to 43%. Usage of effective participatory adult learning techniques have grown within ADRA's education programs. One example is the REFLECT method of community-based learning that ADRA Cambodia began in 2003. In this program, the women of a village are invited to join a community group where they can get together on a regular basis in their village for discussions and learn from one another about issues important to them. Key areas of learning incorporated into the REFLECT program have been literacy, numeracy, how to increase family incomes, how to live healthier lives, family planning, HIV and AIDS, the dangers of human trafficking, how to take good care of their children and be a better parent. The program has become very popular, and it was not long before the men of the village also wanted to have their own REFLECT groups, including topics on how to grow better crops and gardens. Preschool children's groups have also been organized, giving them a head start in basic life skills and ensuring that families actively participate in their child's early development and education. The overall impact of the REFLECT program has been a major reduction of family and community violence, improved food, water, health, and income security, and a major rise in school attendance as parents began to understand the vital importance of education. ADRA Cambodia has also been at the cutting edge of adult learning through its use of adventure learning programs. Both the young and the old are learning leadership, communication, and problem-solving skills through fun activities, as well as developing better self-confidence, teamwork, and interpersonal relationships to make a difference in their own life as well as their community. Now, after 20 years of service in Cambodia, ADRA remains dedicated to working in values-based partnerships for the long-term sustainable development of communities, families, and individuals. Building on these years of experience, ADRA Cambodia is committed to continuing their service to those in poverty and distress, bringing better health, pure water, sanitation, food security, and educational opportunities.
Somehow